But let's start. So, Assalamu alaikum, everyone. Good morning, good afternoon, good evening, depending on which time zone you're joining from. So, I would like to welcome all of you to next in the series of these webinars that we've been doing every 2 weeks under the Apna Merit, which is the Association of Pakistani Physicians in North America. The subcommittee is Merit, which is Medical Education, Research, International Training, and Transfer Technology. So we have these series of webinar looking at the research and innovative landscape in Pakistan, and we do these webinars every 2 weeks on Saturdays, and invited several people from either Pakistan or US or other places to share their experience, and basically to foster education and research collaborations and to sort of inform everybody what is the research landscape. So my name is Sarfraz Hasni. I am a director of the Lupus Clinical Research and head of the Lupus Clinical Trials Unit at the National Institutes of Health here in Bethesda, Maryland. And I've been moderating these sessions. And uh, the the panelist of the long-term consistent panelist of this is Dr. Uzair, but Dr. Uzair is Alhamdulillah at Hajj, and Dr. Sarwat, who joins us from time to time, is here filling in for Dr. Uzair as a panelist for this. And today we are fortunate, backed by popular demand, is Dr. Jabin Fayyaz, who has been with us before. So a brief intro of Dr. Fayyaz is that she has joined the Hospital for Sick Kids in Toronto in 2016 and is currently a staff physician and associate professor at the University of Toronto. She, after graduating from medical school, she was a faculty of pediatric emergency medicine at the Aga Khan University for almost 5 years, and she has been recognized in one of the few leaders in Pakistan with the EM emergency medicine specialty recognized by the College of Physicians and Surgeons Pakistan. After that, she worked at Sultan Qaboos University in Oman, and then after that, she moved here to Toronto. She had a master's degree in health education from Aachen, and followed by a PhD in simulation from Mass General, an affiliate of Harvard in USA. And she has been appointed as the SimKids medical director. So she is going to talk about the simulation and how we can incorporate that in medical education. So we like to welcome and thank you, Dr. Jabin Fayyaz, for taking time out of her busy schedule to be with us. And we are all looking forward to hearing from her, from learning from her. And we'll like to welcome you, and please take it away.
Thank you, Dr. Sarfraz. Assalamu alaikum, everyone. Thank you for a kind introduction. I'm really humbled by that. Today, what we are going to talk about is some introduction to simulation-based medical education. I know medical education has progressed over time a lot in Pakistan as well as globally. But simulation-based education is still in its novice stages, especially if we talk about the context of Pakistan. A lot of educationists are not aware that what it is. So I thought, why don't I share some of the foundational concept of simulation-based education, and then some of the resources. Definitely, I would love to be one of the resource, but some of the other resources which is get to go for you all if you as a faculty or as a student looking for simulation-based education. What I'm aiming to cover today is key simulation terminologies, SimKids medical simulation program, that what we are doing at the Hospital for Sick Children. And when I'm going to tell, I know it is a new SIM center that we got in November, but before that, we have a very rudimentary simulation program. So I just want to tell that what is the possibilities and what globally in North America is happening in simulation. As an example, our SimKit simulation program and some other resources. In terms of my disclosure, I want to disclose my affiliation with all these societies and academies that I'm working with them closely. Now, the first question comes up that what is simulation? There's a lot of misconceptions about simulation, that you need a lot of money, you need a lot of like a space. It is only possible if you have a big building and all the fancy mannequins and fancy gadgets to do simulation. So I hope after today's presentation, some of the misconceptions will get clarified, that what is actually is and what are the pedagogies that are the basis of simulation-based education. So first, if we talk about simulation, simulation is a technique that create a situation or environment to allow persons to experience a representation of a real event. And that could be for the purpose of learning, that could be for the purpose of evaluation or testing, or understand that how a human or a system interact. I will give you a very simple example. जब मैंने अपनी रेजिडेंसी स्टार्ट की थी एट आई एम अ डाउ ग्रेजुएट और एंड आई डिड माय पीट्स रेजिडेंसी इन सिविल हॉस्पिटल कराची तो माय फर्स्ट पोस्टिंग वाज इन द निक्यू जब मैं हाउस जॉब में थी तो एंड दैट वाज माय फर्स्ट मंथ ऑफ हाउस जॉब and I have a preterm that stopped breathing. I started bag mask ventilation, and then the baby didn't survive. I was like literally from 4 a.m. और हमारे seniors आया करते थे 7 से 8 के बीच में. When they enter, I was still trying to bag and I was crying. And then my senior said, I know it might not be a right thing, but उस वक्त वो right ही लगता था. उन्होंने कहा रोने की क्या बात है? This is such a huge opportunity for you to learn intubation in a preterm baby who has passed away. आई अंडरस्टैंड कि इंटेंशन था कि मैं लर्न करूं इस बेबी पर, और फिर दोबारा अगर कभी ऐसी सिचुएशन आए तो मैं दोबारा इंट्यूबेट कर सकूं, कि प्रैक्टिस करूं एक डेड न्यूनेट पर हाउ टू इंट्यूबेट. बट डू यू थिंक अब मैं इतने सालों के बाद जब रिफ्लेक्ट करती हूँ कि एज अ लर्नर वेदर इट वॉज अ राइट डिसीजन, और एज अ learner should I will be put into that situation to learn intubation on a baby who just have passed away and I'm in such a stressful situation. So if you have simulation, or if you have curriculums which are heavily built on a simulation-based pedagogies, then that situation probably learners do not have to face. They must have practiced beforehand. They know a little bit about the anatomy, about the tactics of the skills. They have developed the competencies in intubation-based skills, and then will do it on actual patient population. So this is just to give an example. So the one misnomer is that it is heavily based on technology. कि अगर आपके पास मैनिकिन है, आपके पास बहुत सारे $1,000 of space है, तभी आप कर सकते हैं simulation. It is not that. It is जिस तरह problem based learning है, जिस तरह workplace based learning है, या आप कह सकते competency based learning है, इस तरह ही simulation based learning है. It's a technique that definitely heavily rely on technology, but it is not that only technology is needed for a simulation-based learning activities. So, and it is an educational technique that replaces or amplifies the real experiences with guided experiences that evoke or replicate substantial aspect of the real world in a fully interactive manner, where you are getting feedback from your facilitator, feedback from the peers, and you feel ready to work into actual patient care environment. The second thing which I want to bring up is simulation-based learning activity. A simulation-based learning activity is an array of structured activities representing actual or potential situations in education and practice. What does it do? It allows the participant to develop or enhance their knowledge, skills, and attitude, and to analyze and respond to realistic situation in a simulated environment. Some of the examples are like how to resuscitate, how to run a cardiac arrest scenario, then skills, how to do a lumbar puncture, and then in more sophisticated, how to work as a team when you have nurses, physicians, and many other team members, surgery, anesthesia, how all of these specialties or profession can work together as a team. For all of this, simulation-based learning is a very good alternative. So there are some terminologies whenever you are searching about simulation that you will come across. So let's talk about those terminologies. The first one is mannequin. What is a mannequin? So a mannequin is a life-size human simulator that represents a patient for healthcare simulation and education. It could be a full mannequin, it could be a partial body mannequin, and it is for the intention of doing practice. So, and then they represent various degree or level of physiological function. You will find a mannequin with a low technology, mannequin with high technology. There are mannequins up now who can talk, who can blink, who can show pupillary reflex, who can show the capillary fill time, who will demonstrate the airway sounds, heart sounds, and many, many other things. So, but for each scenario, you do not need a very, very high-tech mannequin. For example, if you have to learn the CPR, only the torso mannequin is enough where you can perform a CPR. For that, you do not need a mannequin who can talk, speak, because the cost of both will be so, so much different. The second term that you will come across while talking about simulation-based education is task trainers. So task trainers are basically part of the equipment that are designed to do repetition of clinical skills so that you will master that skill. So some of the examples are, you can see in this picture, you will see IV cannulation task trainer, the suturing task trainer, lumbar puncture task trainer, the airway task trainer. So task trainers are designed to practice and repetition of the clinical skills, so you will achieve a mastery level. The difference between task trainer and the whole mannequin is task trainers are only part of the pieces which is required for that particular skills. They are durable and you can perform multiple times the same skills on that task trainer, which is not possible all the time in the mannequin. And if it is possible, it is quite costly. The next term that you will hear is simulated person, simulated participant, or standardized person or standardized patient. These terminologies are very much interchangeably used. So there are some scenarios, for example, communication skills, breaking bad news. No matter how high tech your mannequin is or plastic body you have, you cannot practice that human interaction with that. So in those situations, the role of simulated person, participant will come into. These are the people who portray a patient, a family member, a healthcare provider in order to meet the objective of the simulation scenario that you have created for that purpose. And then there are hybrid. Here you can see in the first picture, the mother is a person who is portraying the role of a mother is a simulated person, but the child is a mannequin. Similarly, here they are trying to do a procedure. So the person is a human being, which is a simulated participant or simulated person, but this leg where the procedure is happening is a task trainer. And similarly in the birthing picture as well. So now with the invention of technology, the virtual reality and mixed reality is very much into, and then now it is more further complicated by augmented reality. So what are these? So if you think of a virtual reality, so virtual reality is a use of computer technology to create an interactive three-dimensional world, which is different from the original world. For example, I'm right now sitting in my room, in my study room, and doing this presentation. If I have to do a virtual reality, I probably wear a gadget and then I will be into a different world, which does not have any connection with my current world, which is my study room. So this is a virtual reality. Mixed reality is a category that encompasses the hybrid combination of the virtual reality environment and the reality. For example, which is now called a lot of augmented reality. So augmented reality, you can see in this first picture, the lane, ये similar road है जो कि actually exist करता है. ऑगमेंटेड रियलिटी ने क्या किया है कि विद द हेल्प ऑफ दिस ऐप दे हैव पुट के कहाँ पे होटल है, कहाँ पे कॉफी शॉप है, कहाँ पे गैस स्टेशन है. तो दिस इज बिकम अ ऑगमेंटेड रियलिटी कि जो आपकी रियलिटी एग्जिस्ट करती है, एक्चुअल इन्वायरमेंट है, उस पे इम्पोज होकर by the help of technology you are enhancing, so you will give more information to the person who are using. In the context of education, अगर आप इस पिक्चर में देखो तो ये एक मैनिकिन है जिसपे CPR हो रहा है, लेकिन with the help of augmented reality, when a learner is wearing a glasses, they can see with your CPR how much blood is pumping, how much it is, the fraction is like compression rate is, what is the compression depth, how much blood is going to the brain, all these things because of the help of the glasses. And what it will do, it will help you improve the quality of CPR. So this is what is a little bit difference between virtual reality, augmented reality, and if you combine various combination, it is sometimes called as a mixed reality. Distance, remote और tele simulation is similar to distance learning. जिस तरह अभी हम Zoom पे आप अपने अपने एरियाज में हैं, पाकिस्तान में भी at different places, and I'm in Toronto, Canada, and we are still learning. So we are doing distance learning. If we bring simulation into it, it will become distance, remote, or tele simulation. That is by utilizing communication technology to provide mannequin-based simulation education between learners and instructors, which are located remotely from one another. So this is what it is called, distance, remote, or tele simulation. Then there are certain terminologies which are like, for example, the most important or commonly used is pre-briefing and debriefing. In the pre-briefing is like, as the name indicate, जिस तरह आप एक कुछ भी करने से पहले, जैसे अभी सरफराज ने एक प्री ब्रीफ किया था कि क्या होगा सेशन, कौन करेगा और उसका इंट्रोडक्शन क्या है. सिमिलरली अगर आप सिमुलेशन बेस्ड लर्निंग एक्टिविटी में देखें कि इंफॉर्मेशन और ओरिएंटेशन सेशन which is held prior to the start of simulation activity, in which instructor or provide preparatory information to the participant. The purpose of pre-briefing is to set the stage, to make learner ready what they are going to expect in the next hour or next 45 minutes. And then at the end of the session, it is followed by debriefing. And what is debriefing? That it is a formal, collaborative, reflective process within the simulation-based learning activity where everybody talk about what action happened, why happened, what are the things that went well, what are some of the opportunities to make it better. So that's why a lot of simulation-based educators are called facilitators, because they are not teachers or they are educators, but they are called facilitators in the simulation-based learning activities because they facilitate or guide the reflection, they facilitate the collaboration, and they facilitate the critical thinking. If you're wondering that nobody is going to remember all these terminologies, so please scan this barcode. The barcode will take you to the Healthcare Simulation Dictionary and the second edition of the Healthcare Simulation Dictionary. And this all terminologies and what does it mean is there. Anyone, if you ask any of the simulation educator, they have this dictionary downloaded into all their laptops, all their desktops, and sometime on their phone, because we really rely on like standardization on when and how we are using those terminologies. And regarding the standards, like if you look at any educational pedagogies, it has its standards. So likewise, the healthcare simulation standards of best practices exist. And again, you will see a lot of barcode because I thought it might be easier. There are links as well, but sometimes it is difficult to capture the links from the slides. So that's why you will see barcodes. अगर आप इस barcode को scan करेंगे और scan करने का तरीका ये है कि आप अपने camera open करें, and if you put it on the screen in the barcode, it will give you a link. आप उसको link को click करेंगे, you will go to that document. तो अगर these are the NAACL standards of best practices जो कि detailed document है कि what is a professional development in simulation based education, what is pre-briefing, simulation design, facilitation. So up till now, currently there are 8 standards of healthcare simulation, and there are more which are coming up and adding up. So anybody who want to do something, they should read those standards and follow the guidelines provided by those standards. Please continue typing your question if anything is not either clear or you want some question, and I will take all those questions in the end. एक और चीज जो बहुत ज्यादा आती है सिमुलेशन में कि फिडिलिटी, सिमुलेशन फिडिलिटी क्या है। और कभी कभी सिमुलेशन फिडिलिटी जो है वो सिर्फ ये समझी जाती है कि जितना हाईटेक मैनिकन होगा उतना ही ज्यादा हमारी सिमुलेशन की फिडिलिटी है। So it is not only the mannequin or hi-fi gadgets that define the fidelity. Fidelity is dependent on many other factors. So let's talk about a couple of slides about what is the simulation fidelity. If you look at the definition, it is the degree to which a simulated experience approaches reality. As fidelity increases, the realism increases. Or when are we do, and when as an assimilation based educator, हमारा intention ये होता है कि जितना real हम उस scenario को बना सकें ताकि जब learner learn करे और दोबारा अपने work place पे जाए तो उसको वो उसी efficiency से और effectively patients को manage कर सके, तभी patient care और safety of the patient care improve होगी. So the level of fidelity is dependent on physical fidelity, which is only the one part of the fidelity. और physical fidelity में definitely आपके mannequins आते हैं कि जितना वो, अगर आपका scenario है about a 3-month-old child, तो आपका mannequin at least 3-month-old child लगना चाहिए। ऐसे नहीं कि वो आपने एक बहुत बड़ा सा mannequin रखा हुआ है जिसको आप 3 month कह रहे हैं। That is very, very important. But then fidelity is also important कि आप उस सिनेरियो में कौन सी मेडिकेशन यूज हो रही हैं, कौन से आईवी लाइन यूज हो रहे हैं, कौन से बैग्स यूज हो रहे हैं, तो आप वो भी कैप्चर करके, जैसे हम जब सिमुलेशन करते हैं हमारा लो टेक्नोलॉजी मैनिकन भी होता है तो हम एक्चुअल स्ट्रेंजेस, एक्चुअल नॉर्मल सलीन बैग्स, एक्चुअल एम्बू बैग, एक्चुअल जो भी डिफिब्रिलेटर वो यूज करते हैं, तो दैट विल एनहांस द फिजिकल fidelity. The second is conceptual fidelity.
Conceptual fidelity refers
Oh,
to
sorry.
the
Conceptual
believability.
fidelity होती है, conceptual fidelity में ये होता है कि आपका कितना ज्यादा वाइटल साइंस, ऐसे नहीं कि आपका सेप्टिक शॉक का सिनेरियो है और उसका हार्ट रेट विद इन नॉर्मल रेंज है, तो शॉक में कैसे हार्ट रेट नॉर्मल रेंज हो सकता है, या आपके लर्नर ने गलत मैनेजमेंट किया है तो वाइटल साइंस उस हिसाब से चेंज नहीं हो रहे, तो दैट इज कॉन्सेप्चुअल फिडिलिटी, दैट योर सिनेरियो प्रोग्रेशन शुड रिफ्लेक्ट द एक्चुअल पेशेंट कंडीशन। और थर्ड जो है इट इज कॉल्ड साइकोलॉजिकल फिडिलिटी। साइकोलॉजिकल फिडिलिटी ये है कि अगर आप ये सिनेरियो कर रहे हैं कि यू हैव टू ब्रेक अ बैड न्यूज, या आपको डिफिकल्ट पेरेंट्स से डील करना है, तो उसमें वो पेरेंट्स जो हैं वो एंग्री नहीं है, वो पेरेंट्स जो हैं वो सैड नहीं है, या इमोशंस वो वाले पोर्ट्रे नहीं कर रहे हैं जो एक्चुअल इमोशन होने चाहिए, तो इट विल नॉट लुक रियल. So that's why, to summarize, we do have 3 kinds of fidelity. One is the physical fidelity, second is the conceptual fidelity, and third is the psychological fidelity. इन तीनों के कॉम्बिनेशन से रियलिज्म बनता है। तो अगर आप सिर्फ उस पर फोकस करेंगे कि हमारे पास बहुत हाई टेक मैनिकन्स आ जाएं और हाई टेक मशीन्स आ जाएं, तो इट इज नॉट इक्विवेलेंट टू द एक्चुअल रियलिज्म ऑफ योर सिनेरियो. The next concept is moulage. Moulage is very, very important. Why moulage is being used? Moulage is being used to again create the realism. So moulage is a French word which is used for casting or molding. So that is what moulage, and why it is important. It sets the stage for scenario objective. It enhances the assessment opportunities which support decision making and improve the differential diagnosis. It provides meaningful clues to the patient condition, and it creates a realistic training situations which engages all the senses and the learner experience. like visual, auditory, all sensation को आप include कर सकते हैं. For example, this one, you can see this is all done through moulage, जिसको आप in normal terminologies makeup भी कह सकते हैं. तो if this is a trauma patient, burn patient, तो आप देख सकते हो कि this will project that this looks like a trauma or a burn patient. It can be done on actual standardized or simulated persons as well. And you can see some of the pictures, how well it is depicting a burn, a wound, an injury. And there are multiple gadgets, multiple instruments that can be used for doing a good moulage, and there are courses for doing a good moulage. The next thing that comes is how to choose a type of simulation. Although it is a full lecture on its own, but I give you some of the pointers which will help you that what to choose. Because अगर आपको it is very very important, क्योंकि आप इसमें resource intense है, तो आप ये नहीं कर सकते कि अगर आपको breaking bad news करना है तो आपके पास standardized person नहीं है, आपने hi-fi mannequin लिया हुआ है, hi-fi monitor है और बहुत बड़ी sim lab है, उसके लिए उसकी जरूरत नहीं है. You just need a simulated person. You can do it in a small room in your workplace, in your clinic, or in any isolated environment. Likewise, अगर आपको skill सिखानी है, lumbar puncture सिखाना है, तो then you need to have a task trainer that can allow the learner to learn about the lumbar puncture. So that is why for deciding what kind of methodology you are going to use for simulation-based learning activity, you need to know what is the expected learning outcome, what type of simulation best matches my objective. Do I need and immerse the learner, or will they practice discrete skills? What the level of my learners are and what are they capable of? For example, अगर आपका year 1 resident है और आप उससे expect करें कि वो difficult airway को management करे, team को decide, team dynamics पे work करे और फिर disposition भी decide करे, तो I don't think so it is a realistic expectation from a year 1 learner. So that is why it is very important what are the level of your learner, and choose at the end what best support the learning objective, the learners, and the available resources. So these are at least the bare minimum points that you should consider when you are trying to decide what kind of simulation activity you want to incorporate into the curriculum. Then maybe a question comes, इतने सालों से हम सब पढ़ा रहे हैं, पढ़ रहे हैं, अब सिमुलेशन एक न्यू चीज़ है, तो क्या हमें इसको इंक्लूड करने की ज़रूरत भी है या नहीं है? क्योंकि ऑलवेज ऐसा होता है, प्रॉब्लम बेस्ड लर्निंग आई तो बस हमें प्रॉब्लम बेस्ड लर्निंग को इनकॉर्पोरेट करना है, कॉम्पिटेंसी बेस्ड मेडिकल एजुकेशन है तो उसको इनकॉर्पोरेट करना है. तो आई ऑलवेज से कि सिमुलेशन बेस्ड लर्निंग के लिए आपको कोई नए करिकुलम बनाने की ज़रूरत नहीं है. You need to find out or opportunities or gap in your existing curriculum and then see how or if those gaps are filled or bridge or being dealt in a better way by using simulation-based pedagogies. So simulation-based pedagogy ka benefit kya hai? It provides you a risk-free environment. It engages the learner. You are allowed to do mistakes because you are going to learn from those mistakes. It will enhance the teamwork and collaboration, जो कि हमारी medical education में in terms of clinical medical education में बहुत ज़्यादा missing है. हमें नहीं सिखाया जाता कि नर्स के साथ कैसे कम्युनिकेट करना है, डिफरेंट स्पेशलिटीज़ के साथ कैसे कम्युनिकेट करना है. हमें मेडिकल स्कूल के बाद फॉरन से हाउस जॉब में भेज दिया जाता है एंड वी डू नॉट नो कि किसका क्या रोल है, कैसे हमने कोलैबोरेट करना है और कैसे हमने टीम वर्क को इन्हांस करना है. एंड द लिटरेचर इज फुल ऑफ एग्जाम्पल्स कि हाउ दे डायरेक्टली इम्पैक्ट द पेशेंट केयर एंड क्वालिटी ऑफ केयर दैट यू प्रोवाइड टू योर पेशेंट. Then simulation also improves critical thinking and clinical judgment. It helps you to get organized, to prioritize, and communicate effectively. And then you can control types of patient experiences. Like हमें ये तो सिखा दिया जाता है कि break the bad news कैसे करना है, लेकिन हर patient similarly act नहीं करता. Everyone react differently. So if you create simulation-based scenarios, you can control that reaction and then prepare your learner कि अगर ये reaction होगा तो आप कैसे respond करोगे, ये reaction होगा तो कैसे respond करोगे. And then because it has happened in small group activities and by the help of technology also, you can observe the participant more closely. You can provide them feedback more closely. So these are kind of my initial part where my intention was to familiarize you all with some of the terminologies used, provide you a basic framework where to reach out if you want to look at the terminologies. What does it mean? What are the standards? Why to use and how to start thinking about simulation-based education. The next part will be to talk about my SimKids simulation program, not to just like brag about it, but just to highlight that what are some of the possibilities and how things are working at various places. So as I'm working at SimKids, so I just want to showcase as an example that what are some of the possibilities that can happen by using simulation-based program or by implementing simulation-based program. So our simulation program is called SimKids. It is accredited by Royal College of Physician and Surgeon of Canada. This is a last year data. So we opened a new sim center in November last year, 2023. So it is our data of old sim center because we are still in the process of establishing it and gathering some data. So our old sim center was only 1600 square feet, which is equal to a large lecture hall in any medical school of Pakistan. तो सिर्फ इतना सा हमारा सिम सेंटर था और उस पे we have a 6,870 learner in a year. There were 692 sessions that was conducted, and there were 31,000 almost learners hour that was covered through the simulation center. And we do not only do education, but we do training about patient safety, quality improvement, how to evaluate educational interventions, system design thinking, and then definitely about research and commissioning. We do have a good team of educators and simulation specialists, and I will show you the picture. So in November 2023, we opened up a new sim center, which is almost 11,500 square feet. And it featured the state-of-art simulation facilities with multiple rooms, high fidelity simulation suites, debriefing rooms, and assessment rooms. And I'm going to show you a video, which is almost a minute long, to showcase the space, which will give you a better idea. So this is a little bit of very quick glance of how our sim space look like. I do have a team. This is my co-director, Emily, Luca, and Carrie. I do have educators team and sim specialist team. And then these are some of the simulators that we have at our sim center. These are task trainers here. And then we do 3D printing as well. So there are many simulators or task trainers which are not available. For example, here we do not find anything for a neonatal chest tube insertion. So we created a 3D printed model. Then these are the IO intraosseous line. This is a for ear foreign body model. And then this is here a neonatal tracheostomy model has been created. It is very cost effective, and it is very easily built. And I know in Pakistan, Karachi, Lahore, there's a big technology hub, and a lot of universities, especially engineering universities, have a lot of 3D printing capabilities. So there's a huge benefit of collaborating with them if such things is of interest for any of the institutional leaders or educators. These are some of the projects that we are doing, like, for example, implementation of a CPR coach, using simulation to improve the quality of CPR, to improve the new graduate nurses residency program. Then we do run our interprofessional in situ team training in our actual environment, and a resuscitation training for our competency-based medical education for our fellows, for our faculty. We do have acute event clinical debriefing, where we debrief actual clinical events and then talk about what happened, what went well, where are the opportunities that we can do better. We do some virtual simulation locally and internationally. We do collaborate with various international societies and work closely with them. And then this is kind of some international outreach of sim kits to various countries, including Pakistan, USA, India, Mansoura University in Egypt, and Itqan Simulation Center in Qatar, etc. So please follow us on social media. This is a SimKit social media LinkedIn page for staying stay updated, what we are doing, what are various opportunities we offer. We do have some various training program, which anybody as an international learner can enroll, but you may require funding for that. It is a Learning Institute teaching and education training opportunity. We offer 3 tiers. The first one is the light elective. The barcode will take you to the page which has all the information. The elective is from anywhere from 2 weeks to 6 weeks. The certificate course is for 3 months, and the fellowship is for 1 year. And this is all focused in simulation. Some of the other resources are International Pediatric Simulation Society. I know it is a pediatric specific simulation society, but I will tell you a lot of core concept of simulation are always the same, whether you will apply to pediatric medicine education or any adult education. So the reason why I'm mentioning, because for countries like Pakistan who are who are labeled as low middle income, low LMIC, low middle income countries, you can become a member for free. So that's why I mentioned that you can join it for freely, and then you can have access to all the webinar, all the resources, and many other resources on a discounted prices. I'm the board of director in the IPSS as well. And then if you want to become a member, this is a barcode which you can scan and become a member. The next is Society of Simulation in Healthcare. That is, again, it's a more broader simulation society, and it is for every subspecialty, every profession. And you can go to the Society of Simulation in Healthcare, and you will have a lot of resources there. The Society of Simulation in Healthcare every year celebrate a Healthcare Simulation Week. To this year, it is from 16th September to 20th September, and I'm in the organizing committee, so that's why I'm bringing it up. You can attend, and there will be loads of simulation-based webinars and many other information coming to you. The last part is about introduction to simulation scholarship as a career development pathway, because I know Merit and Apna has a huge kind of focus on research. So I thought to bring it up that simulation can offer a huge opportunity for scholarship and research. And if someone wonder why simulation research or scholarship is important, because this field is rapidly expanding, and this simulation is not only being used for teaching and learning, but it is highly now utilized as an intervention or a method of assessment For example, we built this whole new sim center, and by using simulation, the whole space was get tested before opening. So they will find out what is working, what is not working. Right now, one of my fellow, who's an international fellow, went back home and they were opening a new hospital, and they conducted a simulation before opening it to see what are the part of the system or part of the space is working and where they need some improvement. So that is why simulation is highly being used as an intervention for quality improvement, patient safety, for translational simulation, as a translational method, for a method for human design thinking, etc. And then it is a significant area of practice, need more rigorous research. For example, COVID-19 bring it up that we need more and more research into distance simulation or distance learning, and then possible to use simulation scholarship at a mean of promotion or career advancement. So for that, where to find out the resources? So I want to introduce you to Inspire, which is an international network for simulation-based pediatric innovation, research, and education. I'm board of director for the Inspire as well. You can join again it for free. There's no fee to join, and a lot of offering from Inspire is also free of cost. It established in 2010 from two existing pediatric simulation research network, and to date it is one of the largest simulation research network in the globally, and it usually enhance or encompasses on ongoing research award distribution, mentoring, training in in simulation research methodologies. So you can see it has that much of outreach if you look at the snapshot. And if you look at the productivity, last year it was 49 presentation and abstract, 98 publications, and more than $1 million was given in funding. So the mentorship is offered through Alert, which is a advanced look exploratory research template where you will submit your project. Your project is, you're allowed to present the project in front of mentors, and then you will be assigned an international mentors, and you will be provided or mentored or coached to apply for the funding opportunities. For example, recently Inspire has announced this funding. They announce it each year. So if you go to this barcode, you will go to the funding page, and the last date of submission is on 31st of August if anybody is interested in applying. And I'm happy to give them more information by having a one-to-one session. I have my email at the end. You can reach out to me at any point in time. So just to conclude, simulation is a rapidly advancing field with a specific nomenclature that we should all embrace, learn, and understand for effective engagement for a more broader community. Also, simulation-based scholarship is growing, and it is very much highly viable career pathway for young faculty members. And there are tons and tons of resources, but I did mention a couple, including SimKits, IPSS, Society of Simulation in Healthcare, and Inspire Network, which is available to assess new simulations in any aspect that they are interested. These are some of my references, and this is my email address. Please feel free to reach out to me for any further information or queries or any clarification that you have that you need. With this, I will end up the presentation. I'm happy to take some of the questions, comments, or anything that you have in your mind right now.
Great. Thank you so much. This was such an amazing and timely talk, and I'm sure people have learned a lot and taken up some of the resources. I think that was very nice of you to provide resources. But I would like to hear from our panelist, Dr. Sarwat Hussain. He has a special interest in these technologies. So Dr. Sarwat, please go ahead before we go to the questions.
Assalamu alaikum, everyone. Thank you, Dr. Sahiba. You always bring some really cutting edge education, and your enthusiasm is just coming through the computers. This is fantastic, your commitment and enthusiasm. Well, simulation, as we all know, is new to medicine. It's not new to Oh, I think I got cut off. Oh my gosh.
We
No,
can
Dr.
still hear
Sarfraz,
you.
we can
We
still
can
You
hear
can
you.
hear me? Oh,
Yeah,
sorry.
hear you
Thank
and
you.
see you.
Yeah, okay, thank you. I can't see you, but that's okay. So basically, as people know, that simulation really started with the airline industry, where all the kind of safety and security practices are done beforehand, and the same concept has come into the medicine. And this is the pediatrics one, which really is very, very high, high resource place, but there are other places where people learn laparoscopic surgery and robotic surgery on simulators, very expensive ones, but nevertheless, this is how they start before they start the procedure on patients in order to avoid complications. Similarly, I'm a radiologist, and in intervention radiologist, we have been using like a homemade simulation for a long time. For example, we've been using embedding olives into chicken turkey in order to teach people how to do ultrasound guided biopsy. And similarly, people have been embedding, let's say, grapes in jellies and asking people to do ultrasound guided biopsy. So similarly, every branch of medicine, including interventional radiology, every branch of medicine that has any procedure involved has the application in simulation. But lately, as Dr. Saiba has said, that your communication skills in order to deal with a patient, in order to especially in the Western world, in order to deal with patient coming from different culture and different scenario, is also being taught. Because your actions, your words convey different meaning to different people from different world. For example, just a small example, that if there is a child, putting a hand on the child's head is supposed to be like an expression of affection in our society, but apparently in Far Eastern society, that is taken as an offense. So, these are the kind of thing that people are being taught. So, Dr. Saiba, once again, you are a star, and please come back with some new things. And thank you. I will have Dr. Hasni to take the questions from this.
All right.
Thank you very
Thank you
much.
so much.
Yeah.
Thank you so much, Dr. Sarwat, for your comments. That was very kind of you. And I have a lot of questions and a lot of comments in the chat box. The first question, I will take it from Dr. Sabine Khan, and she is first thanking you and then asking you, how do you incorporate simulation-based learning in undergraduate training? And then she has another question, but I'll let you answer the first one.
Yeah, thank you. Good question. And that has been asked from me all the time. So I will give you an example, and then I will tell that it is through University of Lahore, which is a medical college. I'm doing currently a first cohort of our certificate course in healthcare simulation, where all the faculty is like, I would say 70% of the faculty are undergraduate, like a basic sciences faculty, and only 30% are clinical sciences faculty. Why I'm telling you this example, because when I went in March to University of Lahore they invited me into their medical education conference, that is the question everybody was asking. So I will give you an example. For example, there is a scenario for septic shock. Okay, this is shock who present, and you have given them the scenario. You bring them up, students together, and then rather than teaching them what is the physiology that will lead to shock, what is the pathology that has resulted into shock situation, what is the pharmacological basis separately, what is the shock is, you can combine all of them. So you will have, like, if it is a final year medical student, the expectation from a final year medical student is to identify shock. कि अगर एक 25-year-old patient आया है fever के साथ, cough congestion and now tachycardic और hypotension है, तो उसको उसका ऑब्जेक्टिव होगा कि वो आइडेंटिफाई करे शॉक है, कौन से टाइप का शॉक है, एंड देन प्रोवाइड मैनेजमेंट. बट अगर आप वही सिनेरियो फर्स्ट ईयर मेडिकल स्टूडेंट के लिए कर रहे हैं, तो आप उनको एक क्लिनिकल कॉन्टेक्स्ट प्रोवाइड कर रहे हैं, एंड देन व्हाट आर यू गोइंग टू फोकस is what is the physiology that will lead to a shock, or what is the physiology of fluid, intracellular, extracellular, जो कि हम सिर्फ theoretically पढ़ते थे और हमें अब बिल्कुल याद नहीं है. और हम उसका उस वक्त जब मैं मेडिकल कॉलेज में थी, तो मुझे आज तक समझ नहीं आता कि मैंने कैसा अपने MBBS पास किया है, बिकॉज आई एम वेरी पुअर इन रट्टोफाइंग. तो हमेशा ये याद करना पड़ता था कि कौन सी साइकिल है, कहाँ पहुंचती है, कौन सा फार्माकोलॉजी है, कैसे करना होता है, पैथो के क्या एस्पेक्ट होते हैं. लेकिन अगर आप उनको बताएंगे कि क्यों ये इम्पोर्टेंट है और वो क्यों ये लर्न कर रहे हैं, बाय इंटीग्रेटिंग इनटू अ होल team where they are all students are learning together from level 1 to year 5, so then they will identify कि ये कैसे relevant है. एक मैं आपको एग्जांपल देती हूँ, एक और ट्रॉमा सिनेरियो. ट्रॉमा में आप आराम से एनाटमी पढ़ा सकते हैं कि एक पेशेंट आया है जो एक फ्रैक्चर के साथ है और अब उसको नमनेस है और कोई भी उसकी नर्व डैमेज हो गई है. अब नाउ योर फोकस विल बी नॉट अबाउट कि ट्रॉमा की मैनेजमेंट क्या होगी फॉर अ फर्स्ट ईयर स्टूडेंट. योर फोकस विल बी व्हाट इज द एनाटमी where it is involved, what are the vessels, what are the nerves, what is the bone involved. So this is how you can incorporate very easily simulation based education into undergraduate. और मेरे कहने का मकसद बिल्कुल भी ये नहीं है कि आप अभी उठें और कहें कि कल से हमारा सारा करिकुलम जो है वो सिमुलेशन बेस्ड होगा. नहीं, साल में आप 4 सेशन करें जिसमें सिमुलेशन बेस्ड एजुकेशन को इनकॉर्पोरेट करें, एंड यू विल स्टार्ट स्लोली एंड ग्रेजुअली, एंड देन over time you have built your curriculum which has got enough component of simulation which will provide them meaningful teaching as well as provide them learning all together in teams, and will also teach them non-technical aspects of clinical management.
Thank you so
I
much
hope I
for
make sense. It is a very
no,
very
I-
broad topic. Yeah,
no,
but just to give examples, these are a couple of the examples that you can incorporate.
no, yeah, you answered it perfectly well. And I think the second question that she has asked, you sort of touched upon it during your talk, but maybe if you can expand it for in a couple of minutes, is about the resources, because her question is that implementing in a resource poor setting is challenging because this type of education, simulation-based education, need resources. So I know you have said something about along those lines, but if you want to expand on it a little bit, please.
बिल्कुल, डेफिनेटली आपको रिसोर्स चाहिए. लेकिन जो मैंने देखा है पाकिस्तान जब मैं गई थी, तो हर कॉलेज जो है या हर इंस्टीट्यूट जो है वो सिम लैब को डेवलप करने में ज़्यादा इंटरेस्टेड है और उसमें रिसोर्स खर्च करने में ज़्यादा इंटरेस्टेड है. जबकि जो सबसे ज़्यादा रिसोर्सेज चाहिए वो फैकल्टी डेवलपमेंट में चाहिए. अदरवाइज आप सिमुलेशन एक रूम में, जो कि एक आपका सिंपल क्लासरूम है, उस पर एक टेबल स्ट्रेचर पे रख सकते कर सकते हैं. आई एम डूइंग सिमुलेशन बेस्ड एजुकेशन विद इंडस हॉस्पिटल फॉर लास्ट 4 years, और उनके पास ना कोई सिम लैब है और उनके पास ना ही कोई बॉय हाई फाई मैनिकन्स हैं. जिस तरह डॉक्टर सरवत ने मेंशन किया कि वो डॉल्स को लेके आ जाते हैं, उसको मैनिकन कंसिडर करते हैं, जो उनके एक्चुअल क्लिनिकल इन्वायरमेंट में मॉनिटर्स हैं उनको ले आते हैं. देयर आर मैनी फ्री एप्स जो कि आपके मॉनिटर बन जाते हैं. आप उसको अपने फोन्स पे, अपने लैपटॉप पे डाउनलोड कर लें. नहीं कर सकते तो आप सिंपल पावर पॉइंट स्लाइड्स बना दें ऑफ डिफरेंट वाइटल साइंस टू शो योर लर्नर कि ये मेरे वाइटल साइंस हैं. सिरिंजेस, आपके इक्विपमेंट, ईटी ट्यूब्स एक्सेट्रा जो एक्सपायर हो जाते हैं, उनको आप वो यूज़ करें जो आपके वहाँ पे क्लिनिकल इन्वायरमेंट में यूज़ नहीं हो रहे. मेडिकेशन के लिए एम्प्टी वाल्स लेके उसमें नॉर्मल डिस्टिल वाटर भर के या जो भी टैप वाटर भर के आप उसको एज अ मेडिकेशन यूज़ कर सकते हैं. And then through Indus Hospital, we have created very low cost gadgets. जैसे मैं आपको मिसाल दूंगी कि उन्होंने जो लॉन्ड्री बास्केट है उससे चेस्ट ट्यूब मॉडल बनाया हुआ है, जो सिंपल कार्डबोर्ड और क्लोथ्स क्लिप होते हैं उससे लंबर पंक्चर मॉडल बनाया हुआ है उन्होंने। और इसी तरह जिस तरह बलून में लाइक फॉर आईवी दे हैव डन समथिंग विद बलून एंड फिल्ड इट विद द रेड कलर लिक्विड, और उसको एक स्किन कलर के मुलाज के थ्रू उन्होंने एक स्किन बनाया हुआ है उसके अंदर रखकर दे आर प्रैक्टिसिंग आईवी कैनुलेशन। और अल्ट्रासाउंड मॉडल्स जैसे डॉक्टर सरवत बता रहे थे वैसे। तो resources are required, but not as much as that should become a limitation of not including simulation into your education. There are many, many low resources solutions which are now available. It is just an intent, or I would say जो सबसे ज़्यादा ज़रूरत है resources को utilize करने की या spend करने की वो faculty development के लिए है.
Absolutely. I think Dr. Sarwat has a comment before we go to the next question.
Comment, and the comment is really, I would suggest to the medical institution in Pakistan not to spend money on simulation centers, because what happens is that once you have simulation centers, you have the bragging rights, but then nobody uses it, unfortunately. So unless you have your own, just like the Dr. Sahiba said, unless you have your own homemade simulation scenarios, you're not going to use it. And I know that in one institution in Pakistan, they've spent a lot of money and nobody uses it. Okay, that's number one. Number two, quick suggestion. You can actually simulate, you can actually train people to simulate or express certain diseases and certain scenarios, especially in psychological and psychiatric disease. Thank you.
Yes, बिल्कुल. Thank you so much, Dr. सरवत. आपने बिल्कुल ठीक कहा. और इस तरह के भी अब ये आ रहा है कि HEC ने एक मैंडेटरी कर दिया है that there should be a simulation based lab something in each institute, but I think that is misinterpreted. The intention is to incorporate simulation based education into the education. It's not कि हर center का separate simulation based lab होना चाहिए और with all the facilities. There's so much collaboration can happen कि एक के पास अगर surgical simulation facilities हैं और आप जो हो different area में develop कर लो, and then you can collaborate and cross utilize your labs. Because जितनी भी मैंने 5 centers में जाकर visit किया है और their utilization is less than 10%, और किसके लिए यूटिलाइज हो रहा है? ALS, BLS, POLS के कोर्सेज के लिए पूरा सिम लैब यूज हो रहा है. तो देयर इज अ ह्यूज नीड फॉर कोलैबोरेशन एंड judicious spending of money कि कहाँ पे क्या spend करने की जरूरत है.
Exactly. So you don't have to get every shiny toy, but as you said, that if there is a will, there is a ways. For example, that you mentioned about Indus Hospital that they have. So faculty development, professional development is very important. There are questions about scholarships and how to use resources. I know some of you have already mentioned. And for those of you who have asked for the recording of the session, these sessions are recorded and they are available on the Apna Merit YouTube channel. So as soon as this is done, Waleed and his technical team, who work very hard in the background, will put it up, and also on our WhatsApp groups. It's also available if you're part of the WhatsApp group. So I know some people have asked it to send them to your personal email. I don't know, Waleed, if that's possible, but at least it's possible that you can just go to the YouTube channel and view it as many times as you want. And there is, if you want to answer something about scholarships or how to do that, and then another question, I know there's like tons of questions, but probably these are the last two questions, is that scholarship. And the second question is that if medical professionals who are not doctors, can they do anything, can they pursue their career in medical simulation, even though they're not doctor, but they want to do medical simulation?
Definitely, there are multiple ways. जो मेरी सिम टीम है सिकिट्स में, सिर्फ मैं एक फिजिशियन हूँ. All are either nurses, respiratory therapist, or like one is a speech therapist, and there are many physician assistant, physiotherapist. Like in my PhD cohort, there are many other professions who are doing PhD in simulation, and they are involved in a simulation based education. Other area, जो हमारे sim technologist हैं, they do not have any medical background. They have computer engineering, computer science, those kind of background. So the simulation technologists or technicians or specialists are non-medical background. So yes, there's a huge opportunity. और सेकंड क्वेश्चन क्या था वली, स्कॉलरशिप का. स्कॉलरशिप में एक तो यही कि आप किस तरह की स्कॉलरशिप चाहते हैं. आप ऑलरेडी फैकल्टी हैं और आप रिसर्च करना चाहते हैं, reach out to me or get connected with Inspire. आप Inspire join करें, you will get a huge tons of opportunity. एक दो sessions attend करें and you will know कि किस तरह research कर सकते हैं, and we will provide you mentoring and coaching if you have a project in mind and if you want to apply for funding or even not apply for funding, you just need a research or scholarship mentoring. अगर आप education की बात करते हैं तो then the way is to either go masters in health profession education or PhD program. And there's a follow-up question that how can allied health professional can pursue medical simulation? It is, I would say, right now, it is not that much established in Pakistan. पाकिस्तान में तो ऑलरेडी नर्सेज एजुकेशन पे इतना ज्यादा काम ही नहीं होता, वहां पे सिर्फ हर चीज डॉक्टर्स के लिए होती है लेकिन अब ट्रेंड चेंज हो रहा है, नर्सेज मास्टर्स भी हैं एंड नर्सेज स्टूडेंट्स कैन डू मास्टर्स इन हेल्थ प्रोफेशन एजुकेशन, और आप अपनी नर्सिंग एजुकेशन में कर सकते हैं और अपने लाइक यहाँ पर तो इसीलिए मैं कहती हूँ कि अगर हम जितना फोकस अपने फिजिशियंस की एजुकेशन पे करते हैं, अगर 30% अपने अलाइड हेल्थ प्रोफेशनल्स की एजुकेशन पे पाकिस्तान पे फोकस कर दें तो हमारा हेल्थ केयर मतलब कहाँ से कहाँ पहुंच जाएगा, क्वालिटी ऑफ केयर बहुत इंप्रूव हो जाएगी. देयर इज so much disparity of what doctors teaching and education is and what our nurses teaching and education is, while in North America both work as a same team and they are equal part of the team. अगर मैं कुछ गलत करती हूँ तो मेरी नर्स फौरन से कहती है, जबीन are you sure you want to do this or the dose you are giving me is a wrong dose, can you please recheck. जबकि ऐसा पाकिस्तान में नामुमकिन है, कोई नर्स डॉक्टर को ये बात नहीं कह सकती है. तो लाइक आई एम हैप्पी बिलाल, अगर आप मुझे ईमेल करो तो मैं आपसे रिसोर्सेज शेयर कर सकती हूँ कि कैसे आप अलाइड हेल्थ प्रोफेशनल हो के भी मेडिकल सिमुलेशन को परस्यू कर सकते हो.
Thank you so much. I think it's very kind of you, Dr. Jabin, that you have offered people to reach out to you, and then you have left your email address in the chat also. So anyone who would like to join can do that. And Waleed, if you can just please put the WhatsApp group link in the chat, because a lot of people want to join so that they can join the WhatsApp group and benefit from all the resources that Apna Merit has to offer. And that will be very kind. I think we are over our time limit. I know there's lots and lots and lots of questions, and Hania is asking the same question that previously has been asked. So, but there is link in the chat now how to join the WhatsApp group. And then the last thing is that how, please, can we get the certificate of last webinar? So Waleed, I think this is the question for you and your team to please provide that. And ma'am's email is already there. She has put in like 2-3 times already. So please take that. All righty. So thank you everyone for joining. And again, Dr. Jabin Fayaz, an excellent seminar. I see there's so much, I mean, it's the chat box is lighting up like Christmas tree. And everyone is very engaged and stimulated, and we look forward to hearing from you either as a panelist or as a speaker again. And you're doing tremendous job in terms of educating, in terms of trying to bring, human development is like one of the major things that we don't focus on. So thank you so much. And thank you, Dr. Sarwat, for your time. And
thank you very much. I just wanted to say that I think try simulation in बच्चों की तरबियत में, and try simulation in conflict resolution between husbands and wife for those who are.
Good luck with
Dr. Sarwat, for bringing up. I do it all the time.
Good luck with that. But thank you. So, and last but not least, I would like to acknowledge the work that Waleed and his team does in the background to make sure that these seminars, webinars go very smoothly. And thank you for everyone for joining, and look forward to our next in series in 2 weeks. So we'll come back with a new webinar. Till then, take care. Khuda Hafiz and Eid Mubarak.
Allah Hafiz. Assalamu alaikum. Thank you so much.
Thank you.